basic problem is that Connecticut has a large population of children who are covered under the Husky Medicaid plan. Many of these children aren't able to receive regular dental care.
That is, the children who most need dental care have a very hard time getting it.
Medicaid, unfortunately, doesn't reimburse a full amount, especially when they go to a private dentist's office.
There are currently about 300,000 children under the age of 19 covered under the Husky plan.
And there is no regular dentist in this area that will see any of them.
Many of our children go to school every day in pain from dental problems.
So something that is completely preventable is causing lost school days, face pain, abscesses, infection, misery. Shouldn't have to happen.
I mean, there are a lot of patients that because of they can't go to other places, they forget to go back to the dentist and they don't come in, and they didn't know there was a place like the community health center a lot of times. And you know, I'm seeing young people well below 50 and they're losing all their teeth.
I'm 44, and because I haven't been able to get the right dental care, I'm going to need dentures already, which I never expected to happen. Nobody in my family, even my parents, don't have dentures yet.
Myself, I've been working in restaurants on and off for 25 years. Anybody that knows the restaurant business, they do not offer medical insurance.
And it's not my fault that I was in an accident and I'm disabled and can't afford dental insurance.
I live on tips. I don't make much an hour, so I need to count on the extra help from the state, which would be the SAGA in my case.
I almost tried to pull my own tooth. That's how bad it got, because I didn't know where to go.
I've made numerous phone calls to several dentists, and time again I've been just turned down.
So you called and they said, no, we're not going to take you, or they said we're all filled with the amount of state patients that we take.
Keeps getting infected, and I either can't get to the dentist or I have to go to the emergency room to get pain medication, so the tooth is actually not getting fixed. It's just sitting there being a nuisance in my mouth.
So it's just so frustrating that you just ignore until it gets so bad that you need your teeth pulled. And now I've had to live without having teeth. I'm embarrassed. Nobody knows what to do because you're just told this is the way it is, and you have to live with it.
State legislators should be supporting the statewide oral health plan, which is being developed under the auspices of the Department of Public Health.
The main goal was to ask the legislators to put enough money into the budget so that dentists could actually get paid a reasonable amount so that they would actually see children.
We need more funding for dental, not only for people like me, but for the senior citizens that need, dentures, or the little children with their first teeth where the dental is most important.
This statewide oral health plan includes things like increasing fees to Medicaid providers, as well as providing oral health education in school curriculum and improving relations between the managed care organizations who administer the plans and the providers. In as rich a state as Connecticut is, we should be able to provide the care that is needed for all of our population.
Please, we need some help. Can't you help us?